Hello everyone, I am Dr. Bodhisatwa Choudhuri, consultant critical care and internal medicine, Parkview Super Specialty Hospital, Salt Lake, Kolkata. I have been practicing for last 15 years, and today we are going to talk about understanding hypertension. Now, first we need to understand what is high blood pressure or hypertension, and then we will discuss how to prevent it. Now, generally, everyone would like to have a healthy or normal blood pressure. But what exactly the normal and healthy blood pressure means? So, basically, every time our heart rate beats, it pumps a certain amount of blood towards our blood vessels. This creates pressure against the walls of the blood vessels, which is called blood pressure. In healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and is left untreated, it can cause serious health complications. In general, persistent increase in blood pressure higher than the normal range of pressure is known as hypertension. Now, this high blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices like not having enough regular physical activity or exercise. It can be because of obesity, smoking, alcohol consumption, stress, etc. There are various other risk factors like age. When people get older, the arteries stiffen up. It causes and BP becomes more narrow as excess fat builds up, which causes increased hypertension. Having history of high blood pressure, it has been seen that one or more those family members with hypertension, the chances of having hypertension is significantly high. Excess salt intake, it is known to cause raised blood pressure. Low intake of potassium-rich food, one more thing. Eating processed or fatty food can significantly increase the chances of having hypertension. And last one is stress. Reacting to stress in unhealthy ways can significantly increase your blood pressure and other comorbidities. Now, hypertension does not have obvious signs and symptoms. That's why it's commonly called as silent killer. It puts people at risk for several diseases like heart diseases, kidney failure, stroke, even eye problem. It can cause eye stroke, eye hemorrhage, or even blindness. So early diagnosis and accurate diagnosis of hypertension is very important to management of this. Measuring the blood pressure is the only way to know whether the patient have any high blood pressure or not. Generally, when symptoms do occur, they include morning headaches, tiredness, vision changes, there can be buzzing or ringing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, one should definitely get the blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument which is called known as, in medical term, sphygmomanometer. A sphygmomanometer, in German term, we call it BP cuff or BP check machine. Now, our blood pressure is checked in two parts. One is systolic, one is diastolic. When we record the blood pressure, we give two numbers. We always see there will be two numbers. Like in healthy normal people, the normal blood pressure range is around 120 by 80. This 1 by 80 is a systolic one, 80 is a diastolic one. The upper number of any blood pressure reading is known as systolic blood pressure, which means pressure in the blood vessels when the heart contracts. Whereas the lower number is diastolic blood pressure. It means the pressure in the blood vessel where the heart rests between the beats. If your blood pressure level is more than 140 by 90, then the person is known to have hypertension. If a person persistently has BP more than this, then that person has a significantly higher risk of having cardiovascular or any other comorbidities and should definitely be under some kind of treatment for this. May 17, we celebrate this day as World Hypertension Day. It's a day dedicated to highlighting the importance of monitoring blood pressure and bringing a global awareness to the 1 billion people living with high blood pressure worldwide. Now, the theme of this year's World Hypertension Day is measure your blood pressure, control it, and live longer. Ensure that your BP is measured and controlled if it is elevated. Now, the risk can be prevented by multiple steps. We'll go into them one by one. Now let's start with the most common and the most important one, regular exercise or physical activity. Exercise can be a drug-free approach to lowering the high blood pressure. Regular physical activity, it makes a person's heart stronger, and if one has a strong and healthy heart, it can pump blood with less effort. So if heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. In other case, as we all are aware that age and weight gain are also two major risk factors of high BP. So if the blood pressure is a desirable level that is less than 120/80, exercise can help to prevent it from rising as you age. Because we know as you age, your exercise capacity will definitely get lowered. When you exercise, you also helps you to maintain your healthy weight, which is another important factor to reduce your blood pressure. One should aim to have at least 30 minutes of aerobic activity for most days of the week. High BP level can also be reduced by doing regular structured exercises like brisk walking, jogging, or swimming. Next comes healthy diet. Now, diet also plays an important role in controlling our blood pressure. A diet with high intake of vegetables, fruits, or whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt few dietary patterns, like the first one being DASH diet or Mediterranean diet. So, what is DASH diet? DASH diet means it stands for Dietary Approaches to Stop Hypertension Diet. Now, it's a diet which is rich in whole grains, fruits, vegetables, and low-fat dairy products, and skips on saturated fat and cholesterol. And this, if you take regularly, it can reduce your blood pressure by up to 11 millimeter mercury if having high blood pressure. Second is reduction of sodium in your diet. Even small reduction in the sodium in the diet can improve your heart health and reduce blood pressure by around 5 to 6 millimeter mercury if you have high blood pressure. So to decrease the sodium in your diet, you can do some few things like read the food labels, which food contains low sodium and which food contains less sodium, and you go for the low sodium alternatives for the foods. Eat fewer processed foods. Processed food like the packaged foods, like whatever you can go for chips, cheese, all of this, they have added sodium to them. You can avoid those foods and you can eat natural products that they have been taking these processed foods. And lastly, don't add salt to your food. Try to enrich their taste using herbs or spices because one teaspoon of salt has 2,300 milligrams sodium. That is very, very, very high. So avoid adding extra salt to your food. Next is to get plenty of potassium and eating less saturated fat and total fat. Next, quit smoking. Stopping smoking, it helps to reduce the blood pressure returns to normal. It effectively reduces your risk of heart disease and risk of stroke and improves your overall health. Regular blood pressure monitoring. Now, some of the hypertension patients, we have seen that they check their blood pressure only when they come to doctors. But it's not always possible for patient to visit doctors and check up their BP regularly. As a result, sometimes there are significant gaps between checking the BP where they can become victims of sudden episodes of high BP. So most of the time I advise my patients for self-monitoring of blood pressure levels. Self-monitoring, it helps the person to measure BP at different times throughout the day and over a longer period of time. It also assists the doctor to get a more accurate and more complete picture of patient blood pressure readings at different times. It further helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measurement at the point of doctor visit. There's one more therapy called one-foot hypertension, where what happens because of anxiety and stress, when a patient comes to a doctor, the blood pressure of the patient goes up at the time of doctor visit. Actually, the BP might not be that high. So that increases chances of wrong treatment. So it's always better to do self-monitoring of blood pressure at home multiple times in a week. Next comes stress management. By learning how to relax and manage stress, one can improve the emotional and physical health and lower high blood pressure. Stress management the techniques include exercising, listening to music, focusing on something calm and quiet, and meditation. If you can do them regularly, it will significantly help in reducing your regular blood pressure. And lastly, adherence to medicine. It is very important to take blood pressure medicines regularly. A medicine to lower the blood pressure may be recommended by a doctor if your BP is consistently high, it is more than 140 by 90 millimeter mercury. And it is very important you take them on a daily basis and don't skip and don't suddenly skip it when you feel the BP is on the lower side. At last, I would like to suggest there is nothing more precious than having a fit and healthy life. Adapting a healthy system can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure level with regular monitoring and preventive care. Thank you.